harm Obamacare inflicts on the American people. And I just have to say, this is the first time I've had a chance to sit in front of the Senate. If no harm has ever come to anybody under Obamacare, and it's such a great plan, why are you all not on it? Obamacare is not insurance, but a scheme. Some would say, I would say, a Ponzi scheme to pay for medical bills. My firm recommendation is that if you are on Obamacare now, get out while you can.
This moment is really a fight over whether Obamacare's trade-offs justify its protections. The evidence actually shows Briggs' testimony is documented in the Senate record, and his family's experience is serious. But his claim that Obamacare makes his daughter permanently uninsurable conflicts with federal law. Marketplace plans must cover pre-existing conditions. ACA enrollment has grown dramatically, reaching over 21 million marketplace enrollees in 2024, while subsidies can substantially reduce premiums. Critics are right that narrow networks and high deductibles can create real access problems. Republicans are strongest when demanding competition, transparency, and choice, but weakest when one family's experience is presented as universal proof. I lean toward Briggs' market-based argument, but the evidence demands nuance. Like and subscribe for more bold commentary, and tell me, has Obamacare improved healthcare, or simply shifted the costs?
Our first witness is Mr. Christopher Briggs. He is the Publications and Public Affairs Counsel at the Independent Institute. He received his Bachelor's of Arts in History and English from Bowdoin College and holds a Master of Arts in Political Theory from Catholic University. Mr. Briggs.
Chairman Johnson, Ranking Member Blumenthal, and members of the U.S. Permanent Subcommittee on Investigations, please allow me to thank you for the opportunity to testify before you today about the harm Obamacare inflicts on the American people. And I just have to say, this is the first time I've had a chance to sit in front of the Senate. If no harm has ever come to anybody under Obamacare, and it's such a great plan, why are you all not on it? In November 2015, my wife got the most dreadful call a parent can get. The doctor knew why our youngest daughter, Colette, hadn't been feeling well. Blood work had revealed leukemia. So we raced Colette to Inova Fairfax Hospital, the only one in Northern Virginia that treats pediatric cancer, and got there just in time. Now, thanks to Obamacare, we were already in difficult straits regarding health care. Before the ACA went into effect, the market had offered us a wide variety of relatively inexpensive plans that covered specialist care, even out of state. After the ACA, however, all that was left were increasingly costly plans with fewer benefits, including fewer doctors and fewer hospitals. Thanks to the ACA, we were basically restricted to the medical facilities within a short distance of our zip code. The healthcare experts among us will talk about narrow networks. That doesn't even begin to describe the horror. Obamacare made us into medical serfs. We are tied to the land, unable to leave it, even to save a little girl battling cancer, which is why, when we tried to take our daughter Colette to Johns Hopkins up the road in Baltimore, we were denied. Under our pre-ACA plan, which didn't geo-fence sick children from the care that they deserve, she would have been admitted. Now, our predicament was made even more painful by swelling premiums and skyrocketing deductible and maximum out-of-pocket expenses. Pre-ACA, our monthly premiums were about $800 per month, and the maximum back-end expenses was about $3,500, give or take. After the ACA went into effect, our monthly premiums, and this is with subsidies, went to nearly $2,000 per month. Annual deductible and maximum out-of-pocket expenses with subsidies, $20,000 a month, or nearly. And thanks to cancer, which my daughter came down with, we hit those maximums many, many times. So think about that. In the 10 years since the Democrats inflicted Obama's health care plan on us, we had to pay for many, many years, almost $50,000 annually in insurance payments and medical bills. And that was money we did not have. No middle-class family can endure that kind of expense. The upshot of our decade of affordable health care under Obamacare, our savings are gone. And we have virtually nothing left to retire on. And to handle the remaining debt, we are beginning the process of taking out a home equity loan. And this is the subsidized affordability that the Democrats today insist Congress perpetuate. Now, in those dark early days of cancer, when my daughter was first diagnosed, things got much worse than expensive. In 2018, Obamacare literally offered us no plan in our zip code for any amount of money that we could buy that covered Colette's treatment at the one pediatric cancer ward in Northern Virginia, in Nova Fairfax. So under Obamacare in 2018, our daughter was effectively without coverage for cancer, not a common cold or a broken bone, but cancer. What kind of health care plan did the Democrats inflict on us that it can't handle childhood cancer? And we went through another terrifying event in 2020. Now, with COVID sweeping the country in mid-March, the plan we had that year announced that in 2 weeks, it would no longer cover my daughter's clinic, where she received a lot of her chemotherapy. So once again, thanks to the ACA, we were left without coverage for our daughter recovering from cancer. Now, in both cases, we had to appeal to the author of our problems, to the government, to all of you. And fortunately, I was able to persuade, threaten the Senator's Warner's staff to bully, in both cases, an insurance giant back into the marketplace. Now, perhaps to solve the instability inherent in Obamacare, the government could just take over all medical facilities, but then everybody in the country would be at the mercy of the same government bureaucracy that has been brutalizing my daughter and her parents for years. Under single payer, we would have not the circumstantial cancellation of coverage that comes with the socialization of insurance products, but we would have dying in line waiting for care, such as they have in UK or closer to home at the Veterans Administration. In those institutions, the scarcity that we experienced is no longer circumstantial, but deliberately meted out to patients as lethal policy. We watched as the institutions of medicine under Obamacare colluded with a disease against our daughter, and that would be a daily occurrence under single payer for every American who's under it. Now, there's one more harm that Obamacare is inflicting on millions of Americans, and this one is quite hidden, but it is massive in scale. Obamacare is not insurance, but a scheme, some would say, I would say, a Ponzi scheme to pay for medical bills. And since my daughter got very sick under a non-insurance regime, she is now permanently uninsurable. And why is that? It is impossible to buy car insurance after an accident. My daughter has had that accident, and she is permanently uninsurable as a result. So if we ever restore real insurance to this country, and we're going to have to, because what we have now is unstable and will collapse on its own. And single payer is a disaster. My daughter will never be able to have one of those plans. Now, if I had been allowed to keep my pre-ACA plan, as President Obama promised, my daughter today and forever, for the rest of her life, would have ensured durable access to medical care. So in essence, Obamacare turned an insurable illness, even one as grave as cancer, into a permanent pre-existing condition from which my daughter will never escape. But my daughter is not alone. Millions of persons have gotten seriously sick under Obamacare, and more will do so every year. In other words, Obamacare is creating right now a nation of pre-existing conditions. Now, many say they're being helped by Democrat health care, including, no doubt, many at this table will say so later. But as the Democrats help you, because they're helping you, they are harming you permanently for the rest of your life. If any of us ever get sick under Obamacare, you have a pre-existing condition for the rest of your life. So my firm recommendation is that if you are on Obamacare now, get out while you can. And I am asking that this body and the House and the President provide us a way out. There's one correct long-term answer, and that's repeal Obamacare and replace it, not with another planned economy in health insurance, or God forbid, a planned economy in medicine itself. The idea of a plan is the problem. What plan created the iPhone? We should sell insurance the same way. We need to repeal Obamacare and then set up not single payer, but as my colleague at the Independent Institute, who's our president, Graham Walker, has said, what we need is single market across state lines in which millions of Americans can buy real, actuarially sound, automatically renewable insurance products curated to individual needs.
So, Ms. Briggs, I want to delve a little bit more in terms of what you had. When was your daughter diagnosed with leukemia?
November of 2015.
Of when?
2015.
2015. So this was already, Obamacare's in place. What kind of insurance did you have before Obamacare?
Yeah, so when I jumped out of my corporate job and decided to set up my consulting firm, we did a lot of searching in the pre-ACA marketplace to make sure that I could afford to take care of my family as I did this. And what we found was a tremendous number of plans available. So many, in fact, I had to bring in consultants to tell me what would be best for my family. And we settled on a plan that charged us maybe $800 a month in premiums. And the maximum out-of-pocket deductible was maybe $3,500 for the family. And that, as I said in my testimony, that just, you know, I remember when this law was passed, and I turned to my wife and I said, they're going to socialize the insurance products market. This thing is going to explode. Like, there's no way we're going to keep our doctor. It's no way it's going to say it. And, you know, within a matter of weeks in 2014, when it went into effect.
By the way, do you remember what were you paying for that? You said $800.
Yeah, $800 and then about $3,500 on the back end. And then with Obamacare, it went to almost $2,000 right away. This is before cancer.
Per month.
And the back end was about 17,000. I mean, it was really high. Fortunately, we didn't have that because we didn't have cancer in the house. When the cancer hit my daughter, things just went totally crazy. And then, as I said,
And
twice.
Prior to that, you didn't have a real narrow network. You had.
Oh yeah, no. So in fact, we were able to we had, our other children who needed to go to Johns Hopkins, we went to Mayo Clinic. We could go almost anywhere.
So.
And afterwards, no way, we couldn't go anywhere.
Again, over my 30 years, you started getting in-network, out-of-network. I mean, again, the thing was definitely evolving. I'm not saying that the whole thing was perfect, but you could always go out-of-network. Now, you had a higher deductible or higher out-of-pocket maximum, but you could go. Did you have that option with Obamacare?
Absolutely not. No. Well,
You couldn't even go outside a network and pay more. You were just denied using that.
Right. So Johns Hopkins said no. And we thought, well, maybe we'll go to CHOP, Children's Hospital in Philadelphia. And they said no. We even tried at one point because we knew we were going to get less care than we wanted. We thought, well, let's move to Texas. No state income tax, and MD Anderson is there, and Texas Children's Hospital. Maybe we can do that. And what we found out is that there wasn't a single Obamacare plan to buy that covered pediatric cancer care at MD Anderson or Texas Children's Hospital. And that is the same way, that is pretty much to this day.
Mr. Briggs, do you have a final comment that's just burning that you got to get out there?
Yeah, I do actually, and it comes down to this question of fairness. So I was trying to explain to my family a few years ago, like, why is Dad so exercised about our problem, right? And I said, well, imagine, you go to the grocery store last week and you went and bought your favorite candy bar. Say it's a Snickers bar. And you've been doing this for a while, and last week, like every other time you went there, and it would cost $1.50. Price is right on that thing. You go to the cash register, and you pay for it. It's $1.50. Elon Musk is behind you. He buys a candy bar. It's $1.50. Someone from the lower middle class is $1.50. I said, the way we sell health care in this country, at least under Obamacare, is as follows. You go into the grocery store. There are no prices on anything. You take that candy bar to the cash register, and you say, look, there's no prices. What happened? What are you going to charge me for this? And the register, the cash register, the cashier says, show me your taxable income. And then I'll tell you how much I'm going to charge you for it. So for me, it's $5. For the guy behind me, it's $1,000. For someone behind me, it's $2. So what we no longer can suffer under anymore is the equity of fair cost. This is what we really need is the equality of real prices. And that's the huge difference. I have no idea how much I'm going to be charged when I bring my cancer-ridden daughter in for any of her treatments, big or small.
Right.